Hi everyone, and thank you for joining today's event. My name is Bradley Quinn, and I'm the Associate Director for Insight at Health Innovation Manchester. In this brief session, I'm going to provide a very short demonstration of the CVD dashboard we've developed using data from the Greater Manchester Care Record, which provides localities, PCNs, and the broader system the tools to identify individuals at risk of adverse CVD events and who might benefit from a different approach to treatment. We've constructed this tool together with an expert advisory group consisting of clinical and operational leadership, including the SEN, and I've also worked alongside our colleagues in the NHSGM primary care data quality team to formulate the clinical specification. That includes building equivalent search criteria into the GP systems, specifically EMIS and TPP, as you'll hear a bit more about later today. It combines elements of existing searches, including UCL partners and others, to provide a holistic approach that is tailored to the GM interventions and our pathway. We're now in the final stages of testing and validation of the tool and hope to release this functionality soon. So please do look out for further communication on how to access this in the coming weeks. In addition, we're working very closely with our Greater Manchester colleagues to consider how this aligns with wider developments of GM's analytical capabilities and other case finding solutions. So all of the data you'll see today is pulled directly from the Greater Manchester Care Record, the GMCR, and many of you on the call will have been involved in some of the data sharing initiatives around the GMCR. And it's only because of that work that we're in a position as a system to develop tools such as this in the scale that we are. It means we can construct criteria once and deploy them centrally, regardless of the IT system that's in use. As a result, it contains data for any patient registered at a GP in Greater Manchester, which comes from those primary care source systems into the GM Care Record. What I'll show you today is fully de-identified. None of the patient information is directly identifiable, and it's intended to support management of CVD prevention, both at locality, PCN, and even individual practice level. It is possible, under the right conditions and protections, to re-identify individuals, and those equivalent searches are also available to deploy directly within practices. But all of those restrictions operate around role-based access. So you only see data related to patients you have a legitimate clinical relationship with. Because of those recent developments around the GM Care Record, this is all still very new, and the approach will always need further testing and refinement, and that's a continuous process. So please do reach out if you have any feedback. The team are always grateful for thoughts on how this could be further improved. We'd also like to emphasise that tools like this don't in any way replace expert judgment in that clinical assessment, whilst the data can support the shortlisting to identify a patient whose treatment might be optimised. It always requires that additional clinical validation to provide the final confirmation. So jumping now into the demonstration, this is the front page of the dashboard that you can see currently. The tool is completely web-based and accessed via the browser, so you can access it anywhere at any time with a secure username and password. And the first element I'll draw your attention to is the filter in the very top right-hand corner that you can see here titled Cohort. We've built this dashboard in complete alignment with the national CVD Prevent cohorts, so you can explore population figures for any of those cohorts in combination. For the time being, we'll stick with all of those cohorts you can see on the list here, but you'll see shortly how we might utilize that functionality to drill down to some specific groups. On the left-hand side, you can see the proportion of individuals who fit into one of those CVD Prevent groupings who have a particular comorbidity. Around 16% have atrial fibrillation. Unsurprisingly, a large proportion are also hypertensive, and a significant proportion have other complexities like diabetes, around 35%, and are obese, so about 28%. Because all the underlying data is at patient level, it also means we can avoid double counting where there might be overlap potentially between categories. In the middle, you can see how the group breaks down in terms of ethnic category, aligned to the high-level groupings within the census, and then by gender, male or female underneath. Underneath that, you can see the age distribution of the cohort, ranging anywhere from 18 up to 103. And this is a completely filterable element, and you can adjust that to tailor your search. So, for example, if we were to focus on only patients who were over 50, I can add 50 into that lower bound, and you'll see that all of the information at every stage of the dashboard updates. On the right-hand side, you can see a heat map of patient density. So the number of patients in that cohort by postcode sector, which are very small geographical areas. And crucially, again, because this is patient level, that postcode is based on where the patient themselves live, not just where the GP practice is based, which is the approach sometimes taken in other alternative tools. That's particularly key when we consider how we might target activity to address inequalities and to support populations in the greatest need with really targeted outreach and messaging. So I'll now show you briefly how the dashboard changes if we select a specific cohort. At the minute, this is set to all patients over 50, as I say, but if I was to change this to cohort 3, for example, click on that again. So to cohort 3, you'll see the numbers on the dashboard have updated, and this is now filtered to cohort 3, which, based on recommended guidelines and licensing agreements, they're the patients who are eligible for treatment with inclisiran. And for those patients, we can see all of the same measures as before, including that geographical distribution. And it's important to note that the search criteria automatically removes patients that are already receiving that treatment. So those patients are being continually excluded as the search refreshes and that list is cleansed. So you can hopefully see how this tool can very quickly be used to understand the size of the opportunity to segment the population along some of those key lines of inquiry. Moving now briefly just to that patient level view, which I mentioned. So you can see in this view of the dashboard, it's driven by exactly the same data, but this is now patient level information. Each row in this table corresponds to a different patient across Greater Manchester. And again, currently this is de-identified. None of this information is directly identifiable for the demo today. And once again, this is currently filtered to cohort 3 from CVD Prevent, but for the purposes of the demonstration, let's add cohort 1 there too. So this list is updated just those patients who meet that cohort 1 criteria. And for each of those patients, I can see information such as their practice code, their ethnicity, their age, their postcode, and then comorbidity flags. So a 1 indicates that they have that comorbidity, they're diagnosed. A 0 indicates that they don't have a record of that comorbidity against their records. And practices and PCNs might choose to use this element of the tool in combination with practice level searches we've constructed to give that holistic approach to identification and management. The data and the search specification are completely aligned between the two components. And with that brings us to the end of today's demonstration. I hope you've all found it a useful demonstration of the tool and the capability we have available, which is only possible, as I say, through the sharing of data into the GM Care record. Please do look out for further communication in the coming weeks on how to access the dashboard. Once you do have access, we'd always encourage you to provide feedback. We always want to know how to further improve the tools, and there are areas such as how we account for FH, for example, that we're already considering in terms of that next evolution. So thank you everybody for your time today. I hope you enjoy the rest of today's session and have a lovely afternoon. Thank you.